In the heights of the third wave of the coronavirus, uncertainty in the public health sector, as more than 300 nurses did not report for work today. From very early Wednesday, they began calling in sick. Now, Anthony Lugg reports on the impact.
Dozens of public sector nurses did not show up for work Wednesday as scheduled. The Southern Regional Health Authority that covers Manchester, Clarendon and St. Elizabeth was the hardest hit. We were told only 38 of a complement of 91 nurses turned up for the 7 a.m. to 3 p.m. shift at the Mandeville Regional Hospital. At the Percy Junior Hospital, 24 of 35 nurses reported for work. Over at the Maypen Hospital in Clarendon, 30 of the 47 nurses turned up. Chairman of the Southern Regional Health Authority, Wayne Chen, explained how the health facilities responded to Wednesday's developments.
Well, you're calling people who are willing to come. We have competent administrators and personnel on the ground that will always do the exercise and stretch out and do what needs to be done. I say we can do that for the short term, but certainly if it is sustained more than a day or two, it will put a really onerous burden.
Acting Regional Director of the Western Regional Health Authority, St. Andrade Sinclair, said the Cornwall Regional Hospital in St. James was also badly affected.
About 40 at Cornwall Regional up to the time, and I'm seeing some report from St. Anne's Regional Hospital to my other colleague that she's getting reports of nurses calling in sick as well. In terms of the other areas, I'm not really seeing that much, but the morning is young, so as soon as things go by, I'll get some more reports coming in. But yes, it's indeed a fact that there's quite a significant amount of nurses calling in.
Our news center was told that 60% of nurses at the Princess Margaret Hospital in St. Thomas also called in sick. Nurses have been complaining for months about several issues, including low pay, poor working conditions, and fatigue from overwork due to a sharp increase in COVID-19 patients at hospitals. And speaking of overwork, the Southern Regional Health Authority Chairman Wayne Chen says help is on the way for health workers.
The Southern region has already put out an ad, an international ad for more nurses, so helping the thing. We have received funding in the Southern region to engage another 100 plus doctors and nurses, mostly nurses. So we are also looking at the Mandeville Regional Hospital. We are moving the outpatients, and also the outpatient department across the road to the Seventh-day Adventist Church Hall, and then we're converting the outpatient department into more beds. That should be another 25 or 30 beds right there. We're currently looking at the Kendall Convention Center to move some of the patients there, out there. We're looking at the social safety. We have some capacity at the needs of home.